And in 1943, when it was founded, it was just aimed at providing good services to people resident in Europe in the wake of the Second World War. But 65 years down the line, the impact of the Catholic Relief Services has spread all over the world. And the group says it is launching and marking that milestone in grand styles. The reason for which we're joined now by a lady and a gentleman helping us to talk about the journey of the Catholic Relief Services and what the years to come holds for the organization. Joining us now is Ms. Jamilatu Mashood, Localization Partnership Capacity Strengthening Advisor for the Catholic Relief Services, and also Daniel Momone is the country representative for the Catholic Relief Services. And I was just having that conversation backdoor that when I heard your names, I was like, well, are you all Catholics, by the way? It was the first question, Daniel, and you recall me asking you about it. That points to how diverse this group is. But for those who do not know about the Catholic Relief Services, just break it down for us and tell us about your history and how you were formed.
No, thank you very much. And it's a pleasure to be on the show. So as you rightly mentioned, we are 65 years this year. We started way back in 1943. On the back of the Second World War, when there was a humanitarian crisis in Europe, and the Catholic community in the US decided to intervene. And so that was actually the start of the Catholic Relief Services. And when Ghana gained independence in 1957, we started off here as well. And I think the Ghana program is the first in sub-Saharan Africa.
Oh, wow.
Yes. So, organizationally, we are 80 years, and in Ghana, we are 65. We work in about 114 countries, serving over 100 million people every single day. In Ghana, over the time, we've implemented several programs, and I'm sure many people quickly or readily remember CRS when it comes to school feeding. So we've implemented food and nutrition security programs, health programs, agriculture, education, peace building, and a host of other programs. So,
and Jamila, too, I must point out that if there's anything unique about the journey of the CRS, it's just how consistent you have been and how you've kept the momentum going. What's behind that success story of trying to push this over 65, almost 65 years, ever since its existence here in Ghana. What's the secret behind that?
Thank you so much, and good morning to your audience, and good morning to everyone listening to us. So the Catholic Relief Services, we have enjoyed, the tremendous partnership from the government of Ghana, from the communities that we serve. In fact, for the work wouldn't have been possible without the support of the government, the support of the people that we serve. In fact, they have led the initiatives that my senior colleague has mentioned in terms of water, sanitation, and hygiene with health interventions. It has emanated from the communities that we serve. So all these 65 years, our existence has been in Ghana has been because of the wonderful collaboration. That
maybe because we're not giving examples. Our viewers are wondering, okay, in what areas do you operate? How do you go about impacting lives? Daniel, what's the brief response to that? Even before we talk about the anniversary that you have coming up and what plans you have.
So we intervene in a lot of areas, but as an organization, we let government priorities and community priorities define our interventions. And so as we speak today, we have programs in maternal and child health, complementing government's effort to ensuring that we have access to referral, like ambulance systems. So if you go to the rural communities in several northern areas, you would see motor tricycle ambulances. We have modified to be able to serve as ambulances, serving very rural communities. We also have programs in water and sanitation. There's hardly a community in the northern part that you wouldn't find a borehole constructed by us. Not only serving communities, but schools and healthcare facilities, ensuring that they have access to water. We have programs in youth, so training young people in different skills areas.
Also, it's not just about children.
No, it's not just about children.
Right.
It's we even have programs in peace building. These days we have this issue of the prevention of violent extremism in Ghana. So we intervene in all those areas as well.
But how do you get to do all of that? Where does the money come from, I guess?
Very good question, yeah. So we are one of the largest recipients of U.S. government funding, globally. And so we receive funds from various donors, including the U.S. government, foundations, even quite recently corporate bodies. And also we have discretionary resources we apply. So you can see on the screen some of the
Okay, so this is the ambulance you were talking about.
Yeah. And let me talk a bit about this. I remember when we first launched this, we received a lot of criticisms in public. People felt it was inappropriate for a country like Ghana to be providing this to serve as ambulances. But in the absence of the ideal situation, this is a viable alternative. It's nimble enough to go to the hard-to-reach areas in the country, areas that the standard ambulance cannot even go to. So when you look outside of Accra, these ambulances are relieving many communities. This is a commodity van, so ensuring that medical supplies can get to rural communities. And we all know the supply chain challenges of the health system. So these commodity vans move medical supplies from regional and district centers right into communities.
And you also have the units. I'm seeing a building here.
Yes, so let me talk about it, because this is
very
really important. Yes, this is one of the proudest initiatives we've ever implemented. I'm here, you can see the former US ambassador. We were commissioning Ghana's first ever rural emergency dispatch center. Now, why is this necessary? When someone in the rural community places a call for ambulance service, first it comes to Accra, is rerouted. The delay time can be up to 2 to 4 hours. So what we have done is to create these dispatch centers, managed entirely by the National Ambulance System service. So they manage it.
You don't seem to be owning the thing. You create it for the community and just give back to them.
Because that is sustainability. So we work with existing government systems and structures so that our programs are long-lasting and that they are also mainstreamed into government programs.
So you gave this very center to the ambulance service to manage?
Exactly, to manage. But the novelty of it is that the district assembly provided the quarters. We provided the innovation and the equipment. National Ambulance Service provided the staffing. And so this project is ended, but it's still ongoing. And if you speak to the CEO of the National Ambulance Service, he's doing everything possible in conjunction with the Ghana Health Service to scale this up to other areas.
Okay, you know what? What's inspiring about this is it's from individual donations, not coming from the central government. So you need to applaud that. But also beyond it, we see that most of your activities are concentrated up north.
Yes.
Is there a specific reason?
There's a specific. So maybe let me. So over time, we've intervened in several communities across Ghana, several regions, and school feeding being one. We've also intervened in OT region. We respond where the need is. Even quite recently, we've drilled boreholes in Bono and Ashanti areas. But we want to target our resources where the need is greatest. And so in selecting our communities, we look at government priorities, donor priorities. So for example, if you look at most of the donors, in the next 5-10 years, they have prioritized very remote, hard-to-reach areas, looking at the demographic indicators of the country. So we're intervening in these hard-to-reach areas, ensuring that we can lift them up to contribute positively to some of the national indicators. You know
what, if this is not worth celebrating after 65 years, I wonder what else you should be celebrating. And that's why I want to hear from Jamila, to the plan that you have to just celebrate this milestone. I mean, you've done tremendous work, you agree?
Yes, thank you very much. So we have a series of activities planned for next week. Most of it would be at the community level with the people that we serve. We would have commissioning of a limited mechanized water system at the health facility, which is serving the health facility and the communities. We would have our senior vice president joining us from the U.S., from our headquarters in U.S. We have an emergency dispatch center in Gushegu and Kariga, where there will be some activities to mark this event. We also have an early childhood development center, the first of its kind in Northeast, that we will be having a series of activities with mothers who use the service and the health facility as well. There will be a national event. It will be strictly by invitation with our government partners, our donor community, diplomatic corps, our partners, civil society organizations, the clergy in Accra on Thursday. We would also have some church service, Thanksgiving service to be grateful to God for how far He has brought the organization and the people who support our work.
I see, and the future is indeed looking very bright for CRS. But let's look at possibly the plans that you also have, Daniel. Obviously, you would plan so you can execute in the coming years. Are we to see an outreach to other communities and areas?
Yes, so we, as I indicated, we intervene where the need is greatest, and we have a lot of interventions in the pipeline, particularly in the area of agriculture, and it would span several, I think we have about 11 regions. It's going to be about job creation and productivity, so supporting smallholder farmers to produce. We'll continue our wash and health interventions. So yes, we have a lot of programs aimed at targeting several other communities. But let me also talk about what the future holds for us, because as an organization, we believe that we are only here to support and not to sustain our existence. And so in the foreseeable future, we want to strengthen the capacity of our local partners, what we call localization, so that in line with our principle of subsidiarity as an organization, these local organizations can take forward the implementation of programs. But more importantly, that our future programs are going to really focus on system strengthening, because we believe so much in the capacity of the national government to implement programs. And nobody can reach scale and sustainability as much as governments, both at local and at the national level.
Sounds good. Jamila, to any final words, something that you'd want to leave our viewers with, that they need to know about the Catholic Relief Services? And as we look into the future, you should invite me for the 65th anniversary. I'm coming there, whether you like it or not.
Your invitation is automatic. Thank you very much. But just to add that, so I know you are aware of, if you've been to Makola Market, you would have seen our sisters, the head porters. Yes. We have this initiative with the Gender Ministry, putting up some skills development activities in Wali Wali, which would retain these girls in their home to strengthen their families. And we are proud to say that more than 260 girls have graduated. In fact, they've gone through the NBTI exams, have qualified.
Oh, you're even training them?
Yes, they have acquired technical and vocational skills and have undertaken the exams and are graduating as part of this. They've all passed these exams. I mean, more than 260
You can't afford
girls.
to fail if you have this opportunity.
Yes, exactly. So this is something that we are very proud of, and we appreciate the support from the media. In fact, you've been very supportive of our initiatives. You have been with us even in the hard-to-reach areas, and we don't take that for granted at all. So we continue to count on your support to ensure that you even bring to the attention the areas that are the hard to reach, aside the statistics that we know, but the areas that you think that Catholic Relief Services or like organizations should be intervening in.
Daniel, for you?
Well, I think 65 years is almost a lifetime. You know, in many jurisdictions, it means that you're retired. But I like to think that we're only now warming up, because when you look at our socioeconomic needs, when you go to rural communities, the poverty and the deprivation is real. And so, you know, this is more of a, as we celebrate 65 years of intervention in Ghana, it's also a rallying call for us to realize that the work is not finished. In fact, it's unfinished business. And we are very grateful to our government partners, our donors, and our various partners. Because let me also mention, just in the spirit of partnership, that, you know, every result that we achieve is complemented by other organizations. So we all work together in the space. And so this is really a rallying call for us to intensify efforts if we are to meet the SDGs. And our organizational mantra is in their own hands. And that simply means that when we think about people and their development, it's not about what we bring to them, but they are also active participants in their own development. And so we are hoping that we can collaborate, government, the media, other organizations, donors, to ensure that Ghana is not lagging behind on the SDGs, and also that we can meet the aspirations of the ordinary Ghanaian, because the ordinary Ghanaian wants development today, not tomorrow, and not in 65 years' time.
Daniel, Jamilatu, thank you for bringing relief to so many scores of people who are out there, had to reach areas, and yet you're making life better for them. We're grateful.
Thank you.
Thank you.
So
Thank you for joining us. We'll be back shortly. Please stay on the AM show.